Have you take a deep breath in here for me, and then blow it all the way out. Little push. Hi everybody, this is Eva. Today we are going to be working on her ribs, her pecs. She feels like she has some tightness in on the front side, mainly on the left, but we'll probably do both sides, where she feels a little bit of tightness here in the front, and then it kind of wraps around the back side. Do you have any pain while you're breathing in and out if you take a deep breath in for me?
No pain.
Okay. Does it feel tight?
But it feels tight.
It feels tight.
And honestly, it almost feels tight up here in the trap area.
Okay.
Yeah, it kind of like pulls way up here as well.
Yeah. Eva is a massage therapist, so she does a lot of work kind of leaning over a table. She also does some phone work, so she's doing kind of this motion. So we're going to first start by releasing her traps, her levator scap, and we'll just start from there, okay? I'm gonna have you start on this side so you can kind of get a sense of what it would feel like before I move on to this side, okay? So I'm gonna have you take the shoulder and shrug it up for me. Yep, like that motion you showed me. I'm gonna come here and grab that trapezius muscle, and then you're gonna drop that shoulder down slowly as I bring you to the left. And you should feel a nice stretch in that area.
That does feel good.
Yep. And then you're gonna come up again. I'm going to find that same area, and then you're going to drop it down as you lean to the left. Yeah, and you can just take deep breaths with that. How many hours of office work are you doing per week? Shrug up.
And
then drop it down.
Like 14 to 16 hours.
Okay. So quite a bit of time.
Yeah.
And then let's do one more right here, and then drop it down. When I do this, can you feel any tightness on the left?
I mean, it just feels sore.
Okay.
Because that's how it's been feeling.
Yeah.
So I don't really feel any pulling.
Okay.
I do feel like that it's releasing tension on the right side.
Perfect. So now we're going to do levator. So you're just going to come here a little bit more. Drop that shoulder down, and then we're going to look at our left armpit. Beautiful. And then come back up and use two hands, making sure I don't get on your hair. Okay, go for it. Drop down, and then left armpit. Beautiful. And then come back up, and then drop it down, and then left armpit. Amazing. Okay, relax. Do a little bit of subscap. So you're going to be here. You're going to retract that shoulder blade back from you, and then you're going to punch it forward and reach. So retract and hold that position, and then reach forward. Yeah, perfect.
I feel it like in the palm of my hand.
Yeah.
Wow.
And come back, and then reach. Good. And come back, and then reach. Good. And then hold, and then relax. How do you feel like your posture is over the massage table?
I'm really conscientious of my massage posture. That's why I think it's mostly the office work, because when I was in school, I mean, like, that was so driven in me, like posture, you know, and the TAs would come and like touch our spines and pull our shoulders back. So like I have this like check-in all the time when I'm massaging where I'm like, okay, and I do a lot of like lunging and squatting, so that way my and I try to keep my spine neutral, you know. It's like I am pretty aware of my mechanics.
No, that's good.
But of course it is like body work, so
absolutely. And then drop it down for me, and then we're gonna reach towards the right. No, sometimes it isn't easy to have great posture while you're doing body work.
Yeah,
I always have to have those check-ins with myself as well. Then shrug here, and then drop it down.
And I do pretty good at foam rolling after like the nights that I do long massage work days, you know, and I do little things for myself to keep
drop down.
My body mechanics and my body feeling well.
100%.
Yeah.
You have to.
Yeah.
You really do.
I do a lot of self-care.
Shrug here. Then we're going to kind of do a little bit back, and then drop it down, and then look towards the right armpit. Perfect. Good. And then come back. I always say, and then drop it down, and then right armpit. If you can't have longevity in your own body, we can't take care of others.
Yeah.
Shrug here.
Exactly.
And then drop it down. So it's so important for us to have, you know, our own self-care routines. Shrug. And then drop it down. Hold. Good. You're gonna release.
It like was triggered by like a really bad night of sleep. Like I was staying with my sister, and it was like a really soft bed, and I'm not used to soft beds.
And then here. Yeah. Good. And then come back out. How many nights were you sleeping on that bed?
Just like 2 nights.
Okay.
But ever since then, I've been having body issues.
And then come over.
But Jude said it's probably like an underlining thing.
Mm-hmm. Yeah, so when he worked on you, did you have relief?
Yeah, I did, yeah.
And then
it still felt a little like, you know,
sore, tender. Good, come back. Well, let's do one more here. Go ahead. Good, hold, relax.
That's a good one. Yeah, I just felt a little, like I still just felt a little sore after, and like things were still kind of bound up.
Yeah.
But then he said, you know, it's probably like more of like some habitual stuff.
Cross
so
your hands
like,
over your chest.
Like
yeah.
this?
Yep, perfect. Habitual stuff?
Yeah.
Yeah. We're gonna go here, and then we're gonna do a twisting motion, and then we're gonna do a little bit of flexion.
Oh my gosh.
Can you feel that?
I can feel that.
Yeah. Good. So same thing, so a twist to the left, do a little bit of rotation towards the right, and then a little bit of flexion. Yeah, just breathe with me here. Good. We'll probably do 2 more. Twist, bend. Good. Now let's do 1 more. Twist, bend. Okay. Ooh, was that intense?
Yeah, that was a spot.
That was the spot.
That was definitely a spot.
So we'll do same muscle, just a little bit higher on this side. So cross your hands again for me. So we'll be doing the same thing. So here, kind of crunch, and then rotate, and then a little bit of flexion. Okay. Twist, rotate, and then a little bit of flexion. And then twist, rotate, a little bit of flexion. Good, and then relax. How was that side compared to the left?
The second side wasn't as bad, but
Yeah.
I could still feel it.
Yeah.
Yeah.
Okay, let's have you now. I want you to go face down on the table. I'm gonna do a little bit of flexion distraction just to stretch you out. And we'll see if I want to do any other body work with you face down. Have you had the flexion distraction before?
I think so.
I feel like we've done it together before. Yeah. So what do you have going on the rest of your day today?
Oh, I have some stuff that I need to take care of, like personal stuff, and then I actually have some body work later in my own practice.
Nice. Off to work.
But lymphatic, but not till later. So I was
Good.
like, I wanted to make sure there was plenty of time in between the session, and I'm gonna just go on a walk after this
Perfect.
and let it kind of sink in.
Yeah. I know, I always liked her.
It's really nice today.
It's so nice
It's
today.
warm. I'm like actually hot.
I know. I mean, every day is nice
Oh my
here.
goodness, it's spring.
I know. No, the last couple days I feel like it's been hot. Like you can actually like lay out in the sun.
Yeah.
Hot.
It has been.
Yeah. No, it's my favorite. But I'm happy that you're taking a little bit of time after treatment today.
Oh yeah, I always make a point to do that.
Yeah.
It's important.
It is. Well, you want to actually allow your body to like relax and like sink into the work that we did.
Yeah.
I always say that movement right after treatment is also wonderful because you're allowing your body to get into that new range of motion that we just reached.
I didn't even think about that.
Yeah. Because people always ask me, should I exercise before or after treatment? And I always say, it's your preference, obviously, but I prefer after so that you can actually gain range out of that range of motion we just increased.
Yeah.
So you can use that in your workout. But most
That
people like
hip is sore.
the left one.
The left one.
Yeah. Do you usually have hip pain or hip tightness?
Not often, no,
Okay.
but sometimes it happens.
Yeah.
You know.
Well, yeah, as you know, everything's connected.
Yes.
So this hip is a little bit tight. I'm feeling the left QL is a little bit tight, which is probably linked to this up in here.
Yeah.
Potentially compensation.
Well, I was also thinking, because, you know, it made me think about, like, how I'm being, like, my body mechanics throughout the week, you know, while I'm not massaging.
Yeah.
And then when I was at the office, I'm like, oh my goodness, I, like, lean on one side.
Yeah.
I crunch my, like, I pull my shoulder up to my ear to hold the phone. And I'm just like, wow, this office work is actually what's really doing it in.
Yeah. But I love that you're conscious of it, that you can see that and you can make the adaptations.
Yeah.
And that you know what's causing it. Because, like, that's the first hurdle. I feel like that a lot of people need to get over or need to, like, figure out. And that's a lot of the work that I do, is being like, okay, well, what's actually causing that tightness in your day-to-day life in the first place?
Yeah.
So I don't know if you can feel this, but this right heel, I can get almost close to your glute, and this one stops, like, right in there. So you have a little bit of a discrepancy there. Yeah, it's just figuring out, like, what are you doing in your day-to-day life that's causing that? And how can we make modifications so that your body can feel better?
Yeah, I was like, this has got to change.
Yeah, that's half the battle. That's half the battle right there. Yeah, it's good. Do you enjoy the office work?
I mean, it's just like, it's easy, you know, like when I moved down here, it was just something ooh, that's sensitive.
Yeah, you let me know if it's too much. This is your QL. Yeah, breathe in one more. And then all the way up. Good.
It's just something I started doing when I got down here,
Yeah.
you know, to, like, make the adjustment for moving from Washington.
Yeah.
And I'll probably eventually, you know, let go of that too, but it's just been nice to have that kind of consistency.
100%.
Yeah.
I also think when you do body work, it's nice to also have time to do work that's not body work.
Exactly, yeah. Because I really only do body work like 3 days a week.
Yeah.
You know, just for the longevity.
Yeah, absolutely. I know I always, as you know, my Wednesdays are like my office days where I'm like working on office things. So here, and then you're gonna reach up. And I actually love my Wednesdays. I mean, I love my patient care days. Go ahead. But I love my Wednesdays so that I can actually just, you know, sit down and focus my energy on something a little bit different. It feels really good to have a little bit of variety.
Yeah, and then, or if you have like a project you want to do, or a book you're reading or something too, it's like, I like to have...
Here. And then you're gonna go there, and then at the end do a little twist down.
Okay.
Okay, go ahead.
Oh, my goodness.
Good, come back. This is your lat.
I can feel that.
Yeah. Good. Good. And then one more. Come back to me. And then reach forward. You got it. Beautiful. Okay, relax down.
Oh,
good job.
Not expecting that.
So how familiar are you with the active release technique that I do?
I mean, a little familiar, not too familiar though.
So the premise of it is essentially I'm taking one muscle. So like for you, it was, I just did your lat. I'm palpating along that lat and finding, okay, where along that muscle do I feel, you know, an adhesion, a little bit of hypertrophic muscle. And then I'm putting my pressure in on that area. And then I'm having you move through the motion of that muscle as I'm holding it down to allow the muscles around it to glide, to break up any scar tissue or adhesions that's between, you know, your lat and your tricep, or your lat and your rhomboid, or your lat and your trapezius. So all it takes is, you know, between 3 to 5 like really good passes, and you can get some really nice movement.
Yeah, I mean, I still feel that. I didn't realize how bad I needed that.
Yeah. And there's a whole bunch of different, I mean, every muscle in the body and ligament have a protocol, but then it also gets more advanced and you can do nerve protocols. You can also do a protocol where you're working on two muscles side by side, where you're doing different kind of tension on either side of the muscle. So it's very effective. The last course I took in January, there are actually quite a few massage therapists in my class.
And I was thinking like this could be really beneficial to my practice.
Yeah.
Because I do some like, I just call it like pin and stretch, but it's kind of similar, you know?
Absolutely.
Like I do some things where I like pin the muscle and stretch it out and get movement.
This one a little bit right here too. So you're gonna do the same. So here, and then at the end, you're gonna do the twist downwards, okay? Okay, go ahead. And then twist. Yep. And then come back. And then twist. Yeah. Well, yeah, it is like, you know, a different technique. And a lot of the massage therapists that got the certification that I did in January, they are, you know, sports based.
Yeah.
So they like to, yep, come back. Let's do one more. And you can hold at the end. They like to be able to see a change in range of motion, very similar to the way, you know, that I practice and Jude practices. Good, and then come back.
Yeah, because it's great for that kind of stuff, because if someone's like, I want a massage, and you're like, oh, well, it's going to be a little different if you want it to, like, you know, you have to be present, and there's time, and, you know, like, it takes time to do these movements.
Yeah.
It's not like a typical massage that most people think about.
Exactly. It's also, you know, very specific, the work that I do. So you have to be good at, you know, your palpation and actually know, okay, what structure am I on?
Yeah, definitely.
And then from there you have to know how are the fibers running of the muscle, and then you need to know, okay, what is the actual range of motion of that muscle? So I feel like every day as I'm practicing, I'm still, you know, learning and quizzing myself on the different structures.
Oh, I know. That's like how I feel when I massage. I'm always like, okay. Always making sure, you know?
Yeah. So it's like a built-in practice. Okay, I am going to do a little bit of an adjustment right in here, okay? So I'm gonna have you take a deep breath in here for me, and then blow it all the way out. Little push. Good. Beautiful. How was that?
It felt really good.
And then I want to have you come onto your right side and face this painting. I'm going to come behind you first, and I want to do just a little bit more work in that QL. So you can take this bottom leg and bend it. Bottom leg. This one. Yeah. I just want to do a little bit more work. Yeah. So I'm just going to do a tad bit of work here on like your glute med. So to do this, we're going to have your leg straight. Then you're going to bend the knee.
Okay.
Then you're going to do a little bit of that.
Okay.
Towards the
So
floor.
go straight and then
bend the knee. Yeah. And then just a little rotation forward. Yeah. I got you. Leg straight.
dang.
And then knee bent. And then just that little bit of rotation under. Good. Let's do one more here. Good. Bend the knee. Amazing. And then rotation. Good job. Yeah. Yeah. See, you needed this.
I did.
Just a little bit of targeted work. I want to do iliolumbar ligament, just like right in here. So to do this one, you're going to do a similar motion from the lower extremity. So leg straight, then knee in.
Okay.
But your upper extremity, you're going to do a little bit of a rotation, and you're going to press on my elbow.
Oh, your elbow.
Yeah.
Oh, wow.
So you can stay
Okay.
there. Let's bring knee in.
And then-
Beautiful. Yeah. Amazing. Yeah, you got it. It's perfect. And then extend. And then twist. Good. And this one's a ligament, so I hold a little bit longer at that end. Good. Let's do one more. And then twist. Good job. Hold, 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 hold. Beautiful. Okay, stay right there for me. How was that one? Different.
Good.
Yeah. So I'm gonna pull this one towards me. You're gonna cross, cross. And when's the last time you were adjusted?
Well, Jude did a
Bottom
little
leg
adjustment. Whenever I was here, I think it was like a week or 2 weeks ago.
Okay. Did he adjust your lower back?
2 weeks ago. No, not my lower back.
So I'm just gonna do a little bit of an adjustment here on your sacrum. So here. Beautiful. Good. And let's flip onto your other side. So face the cubbies. I feel if there's anything I want to work with over here.
The bottom leg is bent, right?
Yeah, just because it gives you a little bit more stability.
Okay.
We're gonna do same move, so straight, bend, and then rotate. I know. Woohoo! You really can feel it, huh?
I definitely
Straight.
feel this.
Knee bend, and then rotate. Good job. You're breathing. Leg straight. One more. Knee bend, rotate. Good. Okay, stay there. Perfect. And then knee here, bottom leg straight now. Yep. Here, cross. Move my hair out of the way. Good. Then on your back. Like most days I have my hair totally pulled back. But some days I'm like, it gives me a little bit of a headache to do that if I have it like that all day. So I'm like, I need alternatives.
Yeah.
I know when you came in today with your hair down, I was like, that was the first time I've ever seen you with your hair
I
down.
always have my hair up, but I always put it in a clip because I don't like pulling it back.
Yeah.
For that reason.
Yeah.
And also it pulls out too much of my hair. I'm like, I don't want my hair to be pulled out anymore.
I know, I just have like a little elastic in my hair today, but it works. So now I'm gonna do some things that are a little bit more passive for you. I'm gonna still kind of come back into this trap, but now it's less active, more passive.
Okay, yeah.
So like I'm moving your head through the position. This gives me a good opportunity to see how much range of motion do you actually have there. This also allows me to see some people have pretty hypermobile joints. So when they're not actually activating that muscle, I can feel for, okay, how much range of motion do they actually have? And if they have a lot of range without activating those muscles, then I can pretty much assume that they have a little bit more hypermobility. And then I know, okay, I probably shouldn't be adjusting their neck. Or I need to be very, very specific on where I'm adjusting. And I'd say the majority of the time I'm not adjusting someone who's hypermobile in that specific spot. But what I do find is most people that are hypermobile, they're hypermobile in, you know, a couple joints, and there'll be one that's super restricted.
Interesting.
So then that's where I apply
The
adjustment.
What causes hypermobility like that? Do you know? Is it just genetically
It can
driven?
be genetics. It can also be certain activities that you do while you're growing up. So for example, if you're a gymnast, they have a little bit more flexibility in the actual muscles. So when they have a lot of flexibility within the muscles, some of that pressure and force actually goes into the joints and into the ligaments, and it causes those ligaments to be a little bit more lax. Girls that are thinner and taller tend to have a little bit more hypermobility, double jointed kind of thing. So when I get those kind of patients, I'm just doing your scalenes right in here. When I get those kind of patients, I make sure to be very, very specific. Yeah, when I practiced in Colorado, I worked at a clinic, and adjacent to the clinic there was a spinal cord injury rehab clinic there. And so we would do chiropractic care on quadriplegics and paraplegics, and it was like some of the best work I overdid, and it taught me so much because you had to be so specific with your adjustments.
Oh, yeah.
And I would like manually adjust. So I had to make sure I knew exactly where, you know, the hardware was and go above or below that.
Oh, wow. And I can only imagine also like the trust that people have to feel in order, like coming through those kinds of healing experiences.
It was also very fascinating to see their subjective measurements or objective measurements. So most people that don't have a spinal cord injury like that, they're experiencing pain or certain mobilities related to movement. And when you're working someone with a spinal cord injury, it's less about the actual pain and movement and more about like the actual feel. So they'd be like, I feel like I can sit up taller in my chair, or I feel like I have, you know, less stress, less tension in my body. It was very, very fascinating to see the difference and the way their body felt.
Yeah. This side's definitely more tense.
Yeah, you let me know if it's too much.
Oh, no, it's good. But more aware.
Yeah.
I'm like, oh.
That's why I wanted to start with your right side, so you had a good kind of feel of what I was doing and a sense of normal before I go onto this side.
Yeah. This is where I was feeling that pull.
Let me do a little bit of scaling on this side. I can feel the heat coming in the room. It's so nice. How do your scalenes feel?
On this side, tight. Like the whole neck, upper and lower and everything, it all feels very tense.
Yeah, so essentially I'm taking all of the muscles that are responsible for that rotation, lateral flexion movement and working those. So you can see the scalene, how I'm bringing you to the left, how you can see how that muscle is involved when you're answering the phone like this.
I was just thinking that. I was like, oh my gosh, this is exactly what I have to stop doing this with that stupid phone.
I know. Is it just a cell phone or is it an actual
It's an
landline?
actual landline.
Yeah.
Yeah.
Like, we still have those?
We do. Yep.
There was one time where I thought about getting one for the office here. I was like, I don't know.
It's actually pretty nice. I like having like a landline where I just go to, you know.
Yeah. Well, I feel like they're a little bit more reliable.
Yeah.
Because it's not connecting to, you know, like Wi-Fi or servers.
Exactly.
I want you to push your head into my fingers. Perfect. And then relax. And then push. Good. And then relax. And then one more push. Good. And then relax.
I felt that to like my feet. It was like tingling.
I want to do just a little bit of work on this front pec. So here, reach.
Okay.
Okay. So come down, hold for there. Okay, go ahead, reach forward. Good. And then come back towards me. And then reach forward. Good. Come back towards me. Reach forward. And come back towards, hold, and back towards me. Are you left-handed?
No.
Okay. So you're just doing a lot of this as you're doing this.
Because I'm right-handed, I probably hold the phone mostly on my left side.
Then we'll do a little bit of subscap here. So this is here, and then reaching out. I know. She's like, I know this move. I know this area very well.
I do.
You've worked on this area in me before. Good, okay, relax.
So when you're working at that spinal center,
Yeah.
like, is it with people that were just, that was their forever condition? Were people healing?
So they were healing in respect of that they were working through rehab, exercise rehab, in order to gain more motion.
Okay, gotcha.
So it was essentially a team of a lot of like personal trainers, corrective exercise specialists, PTs that were aiding them and guiding through those motions. Come sit up for me. I'm going to do a little scraping on your neck so your legs towards me. So they were healing, but there were a lot of people that had been there for years.
Yeah.
You know, so I saw a lot of, you know, acute spinal cord injuries where it had just happened. And then I had seen some that the patients had been there for years and years and years. So, it was like a combination. Because it's like with anything, like you want to maintain that mobility.
Yeah.
So then once you get it, you want to keep it. And then you're going to lean your head to the right for me. Yeah, like a stretch. So it was an amazing experience. And then you're going to sniff your right armpit without lifting your arm. You just that motion. Yeah. I'm going to come down a little bit. Yeah. You're going to retain a more neutral neck now. Perfect. And then look down for me. Perfect. And then you can relax. How long have you had this tattoo for?
Oh, I don't know.
So pretty. I'm
Quite
going
a
right
long
over
time.
it.
And look at my armpit now.
Yes. Beautiful.
I gotta think about it. I think in like 2018 or something I got it.
Yeah, it's so pretty. Okay, and then back to neutral. And then forward.
Yeah, in Seattle, there's this really amazing tattoo artist. Her name's April Cornell. And she owns this tattoo shop called Alter.
Okay.
And it's such a cute shop, and she's awesome too. She did a really good job at working with me and all that. So
I have 0 tattoos.
I probably would have never gotten a tattoo if it wasn't for my rebellion of being young and being like, I'm gonna do this in spite of my mother.
Every once in a while, I'm like, I could see myself with like a little tattoo. But yeah, I don't have any. I'm like, maybe someday. Okay, how do you feel? Let's have you do a little bit of range of motion. I want you also to move this left arm out a little bit and see how that actually feels within the ribs.
Yeah, it feels a lot better.
So for you, the subscap is a really important muscle because, as you know, it lines the bottom of the scapula, which plays an intricate role in how those ribs and those intercostal muscles work. And so I feel like with you, I felt a lot of like adhesion, like tightness within that layer. If you can picture subscap, intercostals in that layer. So when I worked on the subscap muscle and allowing that to move, both with you seated and with you faced up, it allows those intercostal muscles and those ribs to kind of fall back into like where they should be. And give them a little bit more movement. I would still say with you, I'd like you to work on chest openers, so like thread the needles.
Okay.
I like to do it with elbow bent, so you're getting a lot more thoracic rotation.
Like this.
Yep. So like how I would really recommend it, and you can just watch me, is on all fours. I like to have you sit so your glutes are on your heels so that it removes the lumbar rotation. Hands on the ground, hand on here, and then through and then up.
Okay. Oh.
Little pop. So you can do it with hand long, but then I don't want you to stress the shoulder capsule too much in extension, because I really want it to be thoracic rotation rather than shoulder extension. And when you have the elbow bent, it really makes you aware. And then just trying to get elbow pointed to the ceiling and then back down.
Okay.
Okay, amazing.
I got it.
Yes, okay, you're all set.
you.
You're so welcome. It was so lovely treating you, as always.
Always.